Lee, let's wait one more minute. People are still signing on.
Okay. Yeah, for some reason, my Teams on my laptop just goes bonkers. I don't know what the deal is.
Okay, why don't we go ahead and kick this thing off? Welcome to the monthly research town hall. I'm the new guy. If you haven't met me, I'm John Klein. I'm the interim executive vice president for research and innovation. I guess this is my second town hall. I get to start off with an abundance of good news that I want to share with you today. It won't always be this way on the monthly town hall, but today, this month, there are a couple good pieces of news to share at least. The first is that the funding for the entire university in the General Assembly is about to be locked down. At the latest update from just a couple minutes ago, the new building for the Health Science Center is supported by both houses and is in the final budget, the reconciliation budget, as they call it. So it looks like we're going to see cranes going up in the Health Science Center in the coming years. And that's a real positive thing. We had a funding request in there for cybersecurity programs. That would include money for our cybersecurity certificates and training, as well as other cybersecurity related grants would be pulled into to those sort of efforts. That is looking good. It's not yet, as they say in used car sales, the taillights aren't over the curb, but we're really close on that. And then moving away from the General Assembly, I wanted to let you know that the president is extremely supportive of investments in research, computing, high performance computing. I'm feeling pretty confident that we'll be able to make an announcement sometime in the next few months about replacing our Cardinal cluster, which, as I keep telling everyone, was first stood up in 2008, the year that the first iPhone was released. So we're going to move away from that era. And then last but not least, both good news for the institution and for all of us, and also personally, something that gives me a lot of joy. We received an impact score of 22 on our clinical translational research grant proposal. That does not mean that we're funded. It's a very good score, very competitive one, and we're waiting to see the critiques. This is an institutional grant that reaches into almost every academic unit, and the ones that aren't already part of it will certainly gravitate towards collaboration. So this is to build infrastructure as well as training programs in clinical and translational research. So naturally, it does involve the med school and the School of Public Health and the dental school, but there are people participating in the Kent School, the engineering school. This is a big grant that between the cost share and the federal funds should provide something like $22 million in clinical and translational research over the next 5 years. I can't let that go by. I've personally been working on this for 8 years. Craig McLean carried the torch before me. Before that, there was a CTSA application. So I'm going to take a second here, like at the Academy Awards, and say I want to call out thank yous to Ma Ying Kong, who is one of the core leaders, and then certainly Kenneth Palmer, Max Boacci, Craig McLean. The associate program director is going to be Xiaoping Wang. And then certainly Chris Cunningham and Rachel Shepard played a key role in preparing it. In Kim is going to provide a very innovative business management perspective to the grant. It's a lot of money, so we need to track where it's going. And No certainly played a strong role. Ryan Gilmore could not have done this without her expertise in assembling the budget. And then, sometimes people are recruited to accomplish a goal, and Lee Botner was recruited in part to accomplish this goal. And by golly, she helped us get there. It looks very, very good. So thank you to all of those people. And I think now I'm ready to hand this over to Lee, and we can get on with the rest of the agenda.
Thanks, John. And I didn't do anything. I just brought some knowledge from watching other great people do great research. So
it's a lovely aw shucks there, Lee.
No, it's true. The other person I wanted to recognize was Roberta Brock from the Office of Sponsored Programs. She also worked with us very closely, particularly at the end, in a really collaborative, approach that was very different than I think what has happened sometimes in the past. So I'm very appreciative of her. So next on our agenda is Dr. Loxton, and she's going to talk about that really great topic that we've all been asking, what's going on? And that's our research strategic plan. And so I'm going to turn it over to her. And then Cindy, if you'll give me just a minute, I'll get your slides pulled up.
Thank you, Lee. That's great. Well, congratulations, John and Lee and everybody. Wonderful news for the middle of the day. That's really great. So as I'm sure most of you know, we have been working within the university on a research strategic plan since last summer. I'm getting an echo for some reason. So all of the academic units as well as the graduate school submitted unit strategic plan documents this fall or early this spring. And Kevin Merton and Will Metcalf and John and I have been combing through all of those and creating a draft document that we'll continue to refine with input. But just to give you an idea of where we are now and what the timeline is, we just have a few brief slides. Lee, if you wouldn't mind to go on to the next one. So phase one is complete, and that is we've done a good bit of competitive intelligence, gathering a lot of data, a lot of analysis. Phase two is ongoing, and we will continue to get stakeholder engagement from a variety of people, including the people on this call. And then also phase three ongoing for strategy development for how we approach the particular goals that we set out for ourselves. Lee, I'm only seeing an email now.
You're muted, Lee.
Okay, so next slide, thank you. Would you advance it to the next one, Lee, if you don't mind? Okay, so once again, what will be accomplished next in the next 30 to 60 days? We've got a draft that we're continuing to refine, and we will hire an external graphics provider to make it look pretty. We're continuing to engage with stakeholders. Yesterday, I met with Faculty Senate Executive Committee, and now we're talking to you today, the Research Town Hall, and these are the other people that we will be talking to in the next few days. And then very soon, we're thinking the second week of April, we'll be posting the draft that we have at that point for public comment, and then leave that up for 2 weeks. After that time, we'll analyze all the public content, once again, have the next iteration of the document, and then we hope to complete a final draft by early May to be submitted. Lee, next slide, please. So one thing I just wanted to mention to you guys is that we are continuing to struggle a bit with what it means to be a metropolitan research university and what it means specifically for us living in Louisville, Kentucky, employed by the University of Louisville. How are we unique? And that really is sort of a fun thing to do, and something that we haven't seen articulated as clearly as we would have liked before. So we'll be asking all of you some questions about that when we're asking for input. And we are asking that of ourselves too. Okay, next slide, Lee, please. So here's the outline. We have the outline of what the report is going to be, with the title page, contents, executive summary, mission, talking sort of on page 5, getting to the point that I just said. How is being a metropolitan research university unique, and how is our relationship with the city of Louisville informative in how we describe that? And then we'll have guiding principles, strategic themes, metrics, measurement, and conclusion. Okay, Lee, please, next slide. Just to give you a little bit of an idea of what we have so far in this draft, our guiding principles is that we collaborate with the community, that we act with integrity, and along with acting with integrity, we model that integrity and professionalism for the growing pipeline of students and other researchers. We broaden our participation with interdisciplinary collaborations, foster connections as with the community and other stakeholders. We think it's important, and we've heard from the units, that intentional communication is very important, and that's going to be part of our plan, is to market and clearly communicate both inside the university and outside what we were doing with research and how we can work together on that. And then we understand that we need to continue to strengthen our foundations for success. That will be research development goals as well as research infrastructure goals. But part of that is also keeping up with what's now available with technology that may not have been in a former research or any sort of strategic plan. So we are determined to be current and have every available tool that we can provide to help make researchers more successful. Next slide, please, Lee. So these are the strategic themes that we have at this point to foster our areas of eminence and our areas of emerging strengths, to leverage and grow unique resources and collaborations that we have within the university, attract, support, and retain exceptional scholars, to invigorate innovation, entrepreneurship, tech transfer, and economic development, to invest in our environment and infrastructure, and to advance our arts and humanities. And then next slide, please. So we just want to end with thanking you. A lot of you have already worked very hard to make this process meaningful and to help us get to the point where we are. And it's not just a few people sitting in an office. We acknowledge that that we're working hard on this, but this will be the research strategic plan for the university, not just for our office. So thank you for what you've done to inform our work so far, and thank you in advance for how you will do that in the future. So that's it for me. I don't know if anybody else wants to say anything about it. Okay, well, thanks, everybody.
Thanks, Cindy. So let me pull up just so that we can all see again who all's going to be joining us today with sharing their research. So we have Clara Sears from the School of Medicine. We have Ginevra Cortade, and we have Tamara, I have to think, doing from the College of Arts and Science, and we also have College of Education. And then at the end, Cindy's going to circle back and talk a little bit about some recommendations from NIH for postdoc salaries. And then I'm going to talk, if we have time, a little bit about some upcoming changes to the limited submissions process. Well, let me stop here. And I believe, Dr. Sears, you're the next speaker. So if you want to share any slides, you may.
Thank you. So hopefully you can see the presentation view.
We can. It looks great.
Great. Okay. Thank you for the invitation to provide this overview of our recently funded project on early life environmental exposures and adolescent sleep health. I'm Claire Sears. I'm with the Christina Lee Brown Envirome Institute and in the Department of Medicine. So I wanted to start by providing just a brief overview of the premise for this study. In 2022, the American Heart Association officially recognized sleep health as essential for improving and maintaining ideal cardiovascular health, and they've added it in their Life's Essential 8. This was after accumulating evidence indicated that poor sleep health is associated with obesity, hypertension, hyperlipidemia, diabetes, and cardiovascular disease. Yet current research suggests that the majority of adolescents in the US do not get adequate sleep for optimal cardiovascular health. Moreover, there is this dramatic decline in adolescence that starts after childhood in the number of individuals who meet this definition of having ideal cardiovascular health. And you can see this depicted here in this plot to the right. On the y-axis is the scores based on Life's Essential 8, with higher scores meaning more ideal cardiovascular health and lower scores indicating poorer cardiovascular health. On the x-axis, you can see the age groups, and there's this drop that happens from childhood into adolescence in the distribution, and then there's a decline in the proportion of individuals who meet the criteria for ideal cardiovascular health. And when this decline continues into young adulthood, research indicates that in young adulthood, those who have less ideal cardiovascular health based on these Life's Essential 8 they're more likely to experience premature cardiovascular disease. So there's this need to identify novel modifiable risk factors for poor sleep health during adolescence, which is a critical period of rapid growth and development, and the role it plays in this decline in cardiovascular health. So we hypothesized that early life environmental exposures, both pre and postnatally, may increase risk for poor sleep during adolescence. And for this specific project, we chose to focus on 3 classes of environmental toxicants: phthalates, per and polyfluoroalkyl substances, or PFAS, and metals. So phthalates are plasticizers that are commonly added to personal care products, food packaging, and household goods. And humans of all ages are continuously exposed to these chemicals through everyday activities. PFAS are a group of thousands of chemicals, and many people know them as forever chemicals, and this is because of their ability to persist both in human bodies as well as in the environment. And these chemicals are often used in household goods such as pans or carpeting because of their oil or water repellent properties. For the specific project, the metals we're going to focus on are lead, cadmium, arsenic, and mercury, and these are naturally occurring in the environment. And humans are exposed often to these metals through food, consumer, industrial products, as well as through air pollution. And almost all pregnant women and children in the United States are exposed to at least one toxicant in each of these categories. So most people are exposed to them as mixtures. And these toxicants could potentially act as a mixture to disrupt similar neurobiological pathways that are important for sleep-wake regulation. Therefore, one novel aspect of our project is that our analyses will examine these as toxicant mixtures, which are more relevant to how humans are exposed. So these are the specific aims for our project. For the first aim, we will examine the association of both pre and postnatal toxicant mixtures with adolescent sleep health. For the second aim, we will conduct similar analyses to examine whether these toxicant mixtures are associated with allostatic load, which we use here as a multi-system index measure that can capture biological dysregulation that, when sustained over time, could increase risk for cardiovascular disease. And in aim 3, we will further look into the association of these toxicant mixtures with several biological intermediates. In this figure, it outlines the guiding framework for this project and kind of the ways we're going to break this down into separate chunks to look at it. And so for our study, we are going to use 2 established pregnancy and birth cohorts, the health outcomes and measures of the environment study, or the HOME study, and the maternal infant research on environmental chemicals study, or the MIREC study. And these studies enrolled pregnant women in Cincinnati, Ohio for the HOME study, or across Canada for the MIREC study in the late 2000s. And they have since, they conducted multiple visits during pregnancy, and then they have conducted, since then, multiple follow-up visits with the offspring throughout childhood and into adolescence. And both cohorts have ongoing study visits right now. The HOME study, the children are between the ages of 17 and 20, and they have an ongoing clinical visit. And the MIREC study, the kids are around 10 to 12 years old, and they're currently conducting visits with them right now. So across each time point, the participants provided biospecimens, and we were able to quantify multiple environmental exposure biomarkers, which we'll use in these analyses to look at environmental toxicant mixtures. And then in adolescence, participants were provided with these accelerometer actigraphy devices that we will use to look at sleep health outcomes. And then in both cohorts, they use validated questionnaires to look at different dimensions of sleep. So for our study, we'll be able to look kind of holistically at sleep health from a multi-dimensional perspective. And then in adolescence, they also conducted clinical visits and measured clinical biomarkers in biospecimens. So we'll use these measures to get an idea of some cardiometabolic health outcomes. And we will use all these data and advanced statistical methods to examine the association of these toxicant mixtures at multiple time points with adolescent sleep health. And then we'll also be able to compare these associations across time points to identify when during development children may be more susceptible to sleep-related disruptions from environmental exposures. Finally, I just wanted to conclude by briefly mentioning some related areas that we are interested in case anyone would be interested in collaborating. One would be to examine the impact of these environmental toxicant mixtures on 24-hour movement behaviors. From our preliminary analyses, we know that some of these toxicant mixtures are associated with shorter sleep duration and alterations in sleep timing. And from the sleep and physical activity literature, we know that this could mean that there's also some alterations in daytime activity patterns, which may also directly impact cardiometabolic health. So we think using a 24-hour movement behavior research paradigm could give us a more holistic view of how these toxicant mixtures impact health. A second area we would like to think about is testing potential interventions that reduce exposures to these environmental toxicant mixtures, as well as other environmental factors that impact sleep, and evaluate if sleep improves. There are racial disparities in both exposure to these toxicants and other environmental factors and sleep, so it is important to think about multifaceted system-level interventions and how these could potentially reduce cardiovascular disease risk. And lastly, we think it would be interesting to examine the impact of the exposures to environmental toxicant mixtures on sleep health during other periods of life, when individuals may be more susceptible to sleep disruption related to these types of environmental toxicant mixtures. And two examples of this could be pregnancy for the pregnant person, as well as during menopause. So if anyone is interested in these areas, here's my contact information. Feel free to contact me with any questions, or if you're interested in collaborating. Here are a list of our collaborators for this project at U of L and across several different institutions, and our funding source from EHS and NIGMS.
Thank you so much, Clara. That was very, very helpful to learn so much. I'm very happy that you got your RO1. Congratulations.
I'm glad I made it. I have a bit of a cold, so I'm glad I made it.
Oh, you're fine. Does anyone have any questions for Clara before we switch to the second speaker? It looks like, Luz, you have a question. I can't even talk.
Hi, Clara. I was wondering how you are controlling for sleep and feeding behaviors, right? So if you're looking at that early exposures and you have breastfeed infants versus bottle-fed infants, that changes the sleep patterns that arise, and then family sleep patterns, you build on that. So I'm just wondering where the behavior kind of fits into some of your paradigm and how you're looking at this.
Yes, so luckily for both these cohorts, they do have extensive data on demographic characteristics as well as feeding behavior. So we have food frequency questionnaires, both from pregnant people as well as from the children during adolescence. And then we have early life feeding questionnaires about breastfeeding, about bottle feeding. They even have breast milk samples in some of these cohorts. So we're able to kind of get at those factors and adjust for them in our statistical models. There are also questionnaires about the home environment, and we have some sleep diaries, and so hopefully we can get at some of those other environmental factors related to the sleep environment and sleep behavioral factors that aren't the specific toxicants we're focused on for this analysis.
Any other questions? All right, so we're going to move to the next one. If you can no longer share, Clara, that would be helpful.
Hopefully I can.
It's always hard when you're in a meeting, right? To try to find and get technology to work. It happens to all of us.
I think
All right, so our next speaker is Ginevra Cortade. I don't think I pronounced that right at the first. And we also have misspelled her name on the agenda. So I want to formally apologize to her for that. So let me share her slides. All right, can everyone see her slides?
Looks good.
Okay.
Great. Again, and Lee, thank you. You did pronounce my name correctly, and that's a hard thing to do. My name is Ginevra Cortade. I'm in the Department of Special Education, Early Childhood, and Prevention Science in the College of Education. Lee, if you want to skip, I'll go to, I'm going to talk today about an NSF DRK-12 project called Project Bees, building the epistemology of engineering for students with extensive support needs. And just so you know, the population of students that I'm talking about when I say extensive support needs, that's students with moderate severe intellectual disability that may or may not have autism. Next, please. Lee, can you, thank you. So this is the research team and the curriculum that we're using. So I'm working in partnership with the University of Texas, Arlington. And then also Christine Cunningham, who has authored the curriculum that we're using, is at the Museum of Science, Boston. And then we do have some research associates and graduate assistants here at the university, and then also over at UTA. So the primary objectives for the Project Bees, as we call it, we wanted to investigate elementary teachers' knowledge and skills of teaching engineering, and then supporting engineering practices for this population of students. And what we hope to get out of the project is to develop a framework to support teacher instruction of these behaviors and mindsets, and then use that framework to design, assess, and disseminate universally designed instructional materials. So the curriculum that we're using is out there, it's free. It is not universally designed, in that there is some trouble for students with more significant disabilities to access the materials. So our 4 strands of work are to investigate these teachers' engineering instruction, develop that framework, conduct a design-based implementation research to support this UDL and engineering instruction, and then produce and disseminate the instructional materials. So this is, if you're familiar with Universal Design for Learning, there are 3 main components of that. So it's engagement, representation, and then action and expression. And this is really about what the instruction looks like for our students. So engagement, how do we get our students engaged, keep our students engaged? Representation, we work with a lot of students who cannot read text. So we adapt the materials by using picture symbols or photographs. And then action and expression is giving the students the opportunity to show what they know, even if they are not verbal or vocal. So can they point to picture symbols to answer questions? Is there another way that they can express themselves other than just verbally? And then what you'll see in the middle there are the habits of mind. So we're working on teachers with developing these habits for our students. And there are quite a few of them. So we have cut that down for our work in year 1. So for participants in setting, we have 2 sites, one in Texas and one here. Here we're working in Bullitt County Public Schools in self-contained classrooms for students with extensive support needs, or as they're labeled in this state as moderate severe disabilities. I will say we started with 4 teachers in Texas and 2 here, and we're down to 3 teachers out of the 6, and I'll talk about why in a little bit. And that was just my pretty bees graphic that popped up. So I'll talk to you about intervention and measurement for year 1. So for year 1, our intervention was, we had professional development, a series of them, so 4 different professional PDs. First, we went over engineering as a content area. Many of our teachers are not trained to teach engineering. So that it's a big step for us to ask them to teach engineering to their students when they don't have that background. We also taught them about systematic instruction, which are some instructional processes that we use to teach our students. They're research and evidence-based procedures. And then we did observation, coaching, feedback. We did some teacher interviews, and then some focus groups. So I kind of bled over into the measurement, but the measurement, we did teacher logs. The teachers actually did these logs after they finished their lessons. We did observations in person or through video. They completed a self-efficacy scale. We did focus groups, and then we did post-intervention interviews. So the self-efficacy scale, we were using those UDL guidelines, and what we were looking at is their self-efficacy on understanding engineering practices, how important they felt those practices were, and how confident they felt in implementing the practices. So we had a good number of questions for them, and we gave that pre, mid, and post. Year one data, we did some qualitative analysis, which, to be honest, is not usually what I do. I'm a quantitative researcher, so this has been a good learning experience for me. So the research questions we were looking at, how do elementary special education teachers for students with DSM describe their experiences in teaching engineering to this population of students? So the first study, we're coming up with what we found were surprises and successes for the teachers. And if you'll clickly, it's going to send some graphics across. We triangulated our data with the individual teacher interviews, focus groups, and the self-efficacy data. And what we found was there were more report outs on positives for the teachers as opposed to focusing on what went wrong. Results and findings from the individual interview data. We found some emerging themes. The teachers changed their expectations around whether or not their students could learn this engineering content and these habits of mind. They realized that the communication needs of their students were a little bit more complex than they considered, especially in the context of this engineering curriculum. Some of the materials were barriers, either because it was text or there were not experiments, but design challenges that required fine motor skills that some of our students don't have. From the focus group, some emerging themes that we found were the teachers and sometimes paraprofessionals are over supporting the students, so they're kind of doing it for them before giving the students a chance to try it themselves. There were a lot of modifications that were needed, but overall they were happy with the successful lessons. Self-efficacy results, this is the big list of habits of mind where the teacher's confidence grew the most. And you can read through the 4 of those, but they learned about prompting and scaffolding, differentiation, modifying the text or the language, and then they were able to identify and focus on those instructional key elements for the engineering activities. So these are our self-efficacy results at the 3 rounds, and you can see that the teachers in all of these areas increased in self-efficacy. So just some next steps and overall thoughts. And I'm working with Brian Robinson is in the engineering department, and Tom Treader is in the College of Ed, and we've talked about the lack of focus on engineering instruction in elementary school teacher training. So within our own college, are we preparing teachers to teach engineering at these younger grade levels? Teachers need more support in their classrooms. It's been very hard for them to take on a different type of curriculum. This isn't a structured curriculum or direct instruction, so it's been a lot for them. I'm sure everyone realizes how much is going on out in classrooms these days. There's a lot, especially for students who have disabilities. So it was just a little bit hard for them to take on this new curriculum. So we're looking at how we can support the teachers and the students a little bit better. So as we move on, we don't have student growth measures from year one. So we're going to work on collecting those data and then add on some more teacher growth measures. And that is it for me.
Thank you so much. I found that very interesting. One, because I am challenged myself with with engineering concepts. And then as a parent and grandparent of someone with an intellectual disability, I'm very impressed to hear that you can teach engineering to those types of students. So it was
Definitely.
a very nice presentation and research that I'm glad you were able to share with us. I think there may have been someone who raised their hand, but does anyone else? Let's see, actually now that may have been from earlier. Does anyone have any questions? No? All right. Thank you so much for joining us.
Thank you.
And our next speaker is Tamara Newton. I can't even say anything today. So welcome. And if you want to share your screen, you may.
Okay, hi Lee. Thanks everyone for the invitation. I'm Tamara Newton. I direct the Stress and Health Lab in the Department of Psychological and Brain Sciences. I'm a clinical health psychologist, so I'm interested in how psychology affects physical health, not just mental health. And I take a biopsychosocial perspective in my work. So today I want to say just a few words about what is stress, what is trauma, and then I'm going to focus in on intimate partner abuse and talk about some lessons learned from our research, next steps, and areas of potential collaboration. So what is stress? It's viewed as a process that emerges from the interaction between the person and the environment. And we all know that our responses to stress affect our thinking. We can anticipate stressors before they occur, ruminate on them after they occur. We know that stress affects our feelings. We can feel out of control, overwhelmed, and anxious. But stress is much more than a feeling. It can involve multi-system physiological responses. So it can affect the sympathetic nervous system, hormones such as cortisol and catecholamines, the inflammatory response system, and other physiological systems. Stressors or events can vary in terms of timescale. They can be acute and short-lived or chronic and ongoing, and they can vary by other attributes. So they can be predictable or unpredictable, and they can be threatening, involving social threat or life threat. So what is trauma? Well, trauma is a type of stressor, and today this term is sometimes used casually to refer to any negative event, but it's really meant to capture a certain quality of event. The idea of trauma was used in 1980 in the DSM as an umbrella term to capture the similar qualities of apparently different events, such as combat exposure and sexual assault. In DSM-5 today, trauma is defined as exposure to actual or threatened death, serious injury, or sexual violence. The ICD-11 has a somewhat broader definition of trauma, exposure to an extremely threatening or horrific event or series of events. So this would encompass psychological threats like emotional abuse that are not necessarily life-threatening. Trauma is common. This shows rates of lifetime trauma across 24 countries using the DSM-5 definition from nationally representative samples. There's variability, but overall 70% of people are exposed to at least one traumatic event, and 30% are exposed to 4 or more different events, and similar high rates are seen in other studies. So is trauma linked with health? Well, it makes sense to ask this because trauma is a stressor, and stress involves multi-system physiological responses. And I just want to say that I'm focused on post-trauma health here. There's strong evidence linking trauma to mental health, such as post-traumatic stress disorder, but also other mental disorders, a range of anxiety disorders, depression, and also schizophrenia. The evidence linking trauma to physical health is more variable, but there is evidence linking trauma exposure to age-related chronic physical health conditions, multimorbidity, or the occurrence of 2 or more chronic age-related conditions, and then health span, or years lived without a chronic disease. So there's some evidence that trauma is linked to earlier onset of chronic conditions, and some suggest this could indicate that trauma is related to accelerated aging. So my lab is focusing on intimate partner abuse. It's a type of trauma that affects about 40% of US women and about 25% of US men. It can involve physical or sexual abuse, threats, stalking, or psychological aggression. And right now we're focusing on IPA history in divorced persons. And the reason for this is there's a large separate literature linking divorce history to increased risk for age-related physical health problems, but there's a lot of heterogeneity there. And so we're wondering if there's a role for trauma exposure or IPA exposure. We know that IPA is often cited as a reason for divorce. It's 5 times more common among divorced people than married people, and it's considered a psychosocial vital sign because of its links with health. And so just to think about this from a prevention perspective, a primary prevention perspective in IPA would work on preventing IPA occurrence or reoccurrence, screen for current IPA, focus on safe exit and couples interventions. My lab doesn't do that. My lab is more focused in the area of secondary prevention, post-relationship or post-abuse people, identifying people at highest risk for health problems, and then thinking about how their health risks can be reduced. So some of the lessons we've learned in our research so far, we conducted a cross-sectional study of divorced, physically healthy midlife women. And we looked at the associations between different facets of IPA and markers of inflammation because of the significance of inflammation in age-related disease. And so you can see in the bottom panel, people with a history of stalking had higher levels of C-reactive protein, an indicator of systemic inflammation. And in the top panel, there was a negative association between physical assault history and in vitro stimulated production of interleukin-6, a pro-inflammatory cytokine. So this was not the pro-inflammatory direction we anticipated, but it does link IPA history to a functional effect in the immune system. This is one of about a total of 6 studies overall on IPA and inflammation. So there's a lot to learn, but one early pattern that's been identified across studies is that these connections between IPA exposure and inflammation seem to emerge at midlife and are not always apparent at younger ages. This study also got us thinking about IPA measurement. We focused on specific IPA variables individually here. But if you think about this from a person-centered perspective, an individual person could experience and probably does experience multiple facets of IPA. So it might be better to look at this more holistically. So we started this by just forming some groups, a group of people without physical IPA, a group of people with physical IPA, and a group of people, and these are all divorced individuals with a history of physical IPA and then dominance isolation abuse. And that third group there is often referred to as experiencing coercive controlling violence. We then split the sample into those with one divorce versus more than one divorce. And you can see on the left-hand side for people with one divorce, there's this nice stepwise association between the IPA groups and diastolic blood pressure measured at 2 clinic visits. On the right-hand side, there is no statistically significant association. So what could be going on here? The participants in the study rated IPA collectively across prior marriages. So this kind of assessment approach might be sufficient for people who've had one divorce, but maybe not for people who've had more than one divorce. Some people may have focused on a high IPA relationship, others on a low IPA relationship, others may have tried to aggregate across relationships, and that may have led to misclassification. So we think this means that a more holistic approach is helpful, but we need better measurement methods for people with more than one divorce. So building on this idea of holistic measurement, we're working on a current project using latent class analysis to identify subgroups of divorced persons using multiple IPA indicators. And we're doing this using 2 large national samples. And the graph shows here 6 different facets of IPA, and essentially we're expecting to find unique subgroups of divorced people, some people without IPA history, some maybe with verbal abuse only, some with physical abuse only, and then a group probably who will be elevated on multiple facets of IPA. And then using data available in these data sets, we'll be able to link the subgroups to reports of fear and safety in prior marriages, age-related chronic health conditions, and then we think we can also start to link it to health span or age of onset of chronic conditions, which would be an indirect indicator of associations with accelerated aging. And then we hope to use this to inform our future studies of stress-related inflammation and other biological markers by focusing on the most at-risk subgroups. And this is a collaboration with Dr. Mitra in the School of Public Health and Angie Chow, who's a doctoral student in clinical psychology. Future next steps, depending on what we find, would be to identify mechanisms or intervention targets. This could be diagnosis focused, so it may be that post-traumatic stress disorder, which is a stress reaction, connects IPA and physical health. We could focus more on specific symptom clusters, intrusive memories. The advantage here is this is transdiagnostic. Many people who are trauma exposed but don't have PTSD, but maybe have other mental disorders, experience intrusive memories, and we have some pilot data linking intrusive memories to elevated ambulatory blood pressure. Or it may be that there's a common psychophysiological mechanism linking IPA to both physical and mental health. For example, rumination. We have some evidence that rumination on a negative memory, negative emotional memory, increases inflammation measured in saliva. That's from a lab study. So areas of potential collaboration, anyone who's interested in the pace of aging and composite biological indicators of this, anyone with interest in IPA and health. We're interested in finding ways to recruit very early after divorce and considering interactions with the justice system and how this can influence health. Anybody who has clinical samples and is interested in addressing how trauma and PTSD symptoms may improve medical outcomes. And then in general, anyone interested in cumulative lifetime trauma, PTSD, and health. So I will stop there, and there's my contact information.
Thank you so much. Very interesting research. And I noticed that one of the slides, I think it was previous to this one, you were talking about rumination. There is a College of Education faculty member that I'm drawing a blank on his name, but I can send you the email. He does do research in that area, so there might be a possible collaboration. But great. Anyone else have any questions that Tamara can answer for you?
I see the name. Yeah, someone responded in the chat. Great.
All right. So then Cindy, you wanted to make a quick announcement? You're on mute.
Thanks. Just really quickly, Rachel Sartoris and I wanted to let everyone know that the NIH task force on postdocs has completed an evaluation and is making a recommendation, not a requirement, a recommendation that postdoc salaries be increased And I believe it's around $70,000 a year. It's substantially an increase over the salaries of our current postdocs. So once again, this is not a requirement, it's a recommendation, and we're going to be following it closely. Rachel just went to the National Postdoc Association meeting and was not able to get any further information than that in terms of timeline and if for sure this will be required. So please just keep it on your radar screen, those of you that are applying for grants that may include postdocs on there. Keep that salary range in mind. That's it, Lee. Thanks so much.
Thanks,
Oh.
that's very helpful.
And Rachel, I believe, was going to put the link to that in the chat for that, what we know so far. Thank you.
She did, thank you. And actually, I'm the next one on the agenda, but I'm actually going to turn it over to Cecilia Pareto from the College of Education and Human Development. She had asked me to add her to the agenda, and I forgot. She just needs to make one announcement from the college that involves a collaboration event, and so she wanted to talk.
Thank you so much, Lee. It'll be really quick. So I am from the College of Education. I'm in the research office, and I am coordinating an event for our college. I am seeking researchers who would be interested in demonstrating their research during our college-wide meeting. It would start on April 23rd from 9 to 10. 9 to 9:45 we're setting up tables where the researchers could actually demonstrate their research. We're looking for people who would be their research would overlap with the research that some of our faculty do in the College of Education. Remember, we have a Health and Human Sciences as part of our team as well. We have LEAD, which is our occupational, workforce kind of things in there as well as our MSTED and EPC, our EPCY for our educational psychology. And I feel like I'm missing one. I know I am, special education. So we have a lot of overlap that could work with a lot of, we're looking for partners for research and grants in our college. So in addition to having the 9 to 9:45 demonstration in the Red Barn, we would also ask that some of our researchers would be willing to do a lightning talk. It would be a 30-second talk with no more than 4 slides of their research so that we could start building some of those collaborative relationships with our faculty. We know that we can get more money, we're more competitive when we have partners from other academic units or just having those other strong partnerships. So if anyone is interested, I'll put my name in the chat, my email. Please email me at cecilia.pareto@louisville.edu. And let me know that you're interested, or if you know of somebody else that you think would be a great person, please refer them to me. I'm really a little bit behind the time on here. Things got put together very late, so I'm hoping by early next week that I have my team set up. So if you are interested, please let me know. We're looking for people outside of the College of Education to partner with us. If anybody has any questions, feel free to email me and I will answer all your questions. Thank you, Lee.
Thank you. And so it looks like we have 2 minutes, so I will talk real quickly. Just wanted to let everyone know that we are streamlining the limited subs process to reduce the burden on faculty. We're going to move towards just requesting what we're calling a notice of interest or notice of intent. So you will not have to any longer fill out and do a complete internal application. If we do get more applications than what we're allowed to submit, keeping in mind, for those that don't know what limited subs are, these are the funding opportunities that the federal agencies or foundations that restrict the number of proposals that we're allowed to put forth. So for the majority, that you will only need to put in a few little pieces of information. But if we need to go to a full internal application process, we will. And so I put some information there that I had sort of summarized into the chat, and then this will start being implemented within the next couple of weeks, and we'll add this this language to our website as well. So I hope that faculty find this a much easier process and gives everyone a little bit more time to actually do work on their proposals to sponsors versus doing proposals to us. All right, John, it's 1 o'clock. You're on mute.
4 years and I still haven't figured this out. We're right on time. Thank you, Lee, for putting this together. It's amazing how the town halls have taken off. I think we peaked at about 80 folks here. And
I had 92.
oh, okay. I missed that. And I think somebody had a hand up, but it just went away. Well, thank you all for coming. We'll be back next month, and hopefully we'll have more good news at that time.
Looks like Rachel Neal's got a question about R25.
Is that Rachel?
Yeah.
Okay.
So, Rachel, you're asking about standard letter of support for R25s.
Yeah, I just put it in the chat. They can answer after we hang up. It's fine.
Yeah. Okay. We'll send you a note.
Appreciate it.
All right.
Yeah, and it looks like Stephen Jones was asking about the S10s. Did I see that? Or did I dream that? Maybe that was on my email. All right.
Yeah, I
Everyone-
messaged you, Lee. That's
Oh,
it.
okay.
I mean, it's just, do we just send you an email?
No,
said
no,
it's
no.
simpler.
What
What do
I'll
we
do
do?
is we are going to post it to the site so that everyone
Okay.
on campus can
All right.
see it. And it'll be very brief. It's just going to be the team, a draft title, and 2 sentences.
Super.
Okay.
Thanks.
All right. Bye-bye.